This segment is sponsored by the Prince George's County Department of Health. Their Cancel HIV campaign is dedicated to raising awareness about the importance of HIV treatment, addressing HIV stigma and treatment misconceptions. I spoke to Dr. DeMark Hickson, who's the executive director of Us Helping Us, People into Living Incorporated. Dr. Hickson, welcome to Great Day, Washington. How are you?
Thank you so much. I'm excellent. How about yourself?
I'm good, Doc. So let's get into it. So how does HIV treatment impact HIV?
So we know that HIV treatment or antiretrovirals, they actually reduce the replication or the production of HIV in the body. And so in that case, when individuals are on HIV treatment, that it reduces the amount of the virus in the body that it cannot be detected by a normal lab test. And so in that case, that's what we now call undetectable. And we know that undetectable equals untransmittable, wherein somebody who is living with HIV, who is taking their medications as prescribed and no longer can detect the virus in their body, then they cannot transmit HIV to a sexual partner or during sex. And so we want to encourage individuals who are living with HIV to be on treatment and to become undetectable. However, we know that almost 2/3 of individuals who are living with HIV who are living with HIV in Prince George's County and have been linked to care have achieved viral suppression. So there's 1/3 of the population who have not. So we still have quite a bit more work to do.
Tell us more about undetectable equals untransmissible and why it's so important for us to understand that.
Because undetectable equals untransmittable means that, again, that I cannot transmit HIV to a sexual partner who is not living with HIV. So in essence, we stop the further transmission of HIV and prevent others who are not living with HIV, or how we say HIV negative, will not acquire HIV.
Interesting. So how has treatment for HIV changed over the years? I know there's been many, developments, technology has changed. Tell us about that.
Absolutely. I was talking with a colleague, and I'm a big supporter of our organization, and he was talking about one of his partners who used to have to take in upwards of 40 pills a day, which was also known then as a drug cocktail. But now all of the antiretrovirals are safer. And there's also research that is studying antiretrovirals that can be injected into the body. And someone who is living with HIV only has to see their doctor regarding their HIV only every 3 to 6 months. And they no longer have to swallow a pill, right? So we see a lot of scientific advancement in the treatment of HIV.
It's amazing, isn't it? I mean, there are even movies.
Absolutely.
If you go back and look at movies and compared to now, it's just
Yes.
night and day. And thank
Night
goodness
and day.
right. Thank goodness
Absolutely.
for that. So tell us about what Prince George's County HIV service organizations are doing to support individuals with HIV.
Yeah, so first, I think what is utmost important in knowing how stigmatized and marginalized individuals who are living with HIV can be is that we're providing compassionate and culturally relevant care. So you have agencies such as Us Helping Us, Heart to Hand, SLK Health Services, AHF, others who provide a wealth of HIV care services that just make talking about sex more comfortable, being a support system for individuals who are living with HIV. And we're also working to address the stigma around HIV. So we are trying to educate community members about the use of, about avoiding the use of terms like full-blown AIDS, right? That's an old term that, again, contributes to stigma. We're talking about people living with HIV because they can thrive and survive and live a normal life with HIV. So we're not saying HIV infected, right? So we're really changing the terminology. And so as a network of service providers, we're providing a wealth of other services to address the unmet needs of individuals who are living with HIV, whether that's housing, whether that's mental health, transportation assistance to their medical appointments. We're moving into more innovative ways to provide care, especially with us being in COVID. So telehealth services where you could just talk with your provider on your phone. So we are just creating a network, again, of culturally relevant care, compassionate care for one of the most highly marginalized populations in Prince George's County.
A lot of advances, long way to go. What's the biggest takeaway for today?
Well, things have changed drastically over the past 4 decades. We know that the first case of HIV occurred in the early 80s. So we have individuals who weren't even born yet and did not see, as you've been talking about on the movies, the devastating effect that HIV had in the early 80s and 90s, where we lost a generation. And so, but today, HIV treatment is safer, extends life expectancy for someone living with HIV. But we know that Black communities, the Latinx community, and the LGBTQ plus community are the most impacted. They carry the greatest burden of HIV. And so I would encourage those who do not know their status to get tested. If you know your status and you are living with HIV and out of care, I would encourage you to get into care, because the sooner you get into care, the sooner the HIV in your body can be suppressed and you achieve undetectable status and have U equals U. And if you need help, there's HIV service providers such as us helping us that are here and ready to serve you.
Dr. Hickson, thanks for joining us on Great Day Washington. Great information.
All right, thank you so much.
For more information, visit the website on your screen, health.mypgc.us/ending-HIV, or call 301-583-3150. Also, don't forget to search the hashtag #CancelHIVPGC on social media for more up-to-the-minute information. All right?